Dr. Carlos Del Rio, a professor and executive associate dean at the Emory University School of Medicine. Welcome to the show, Doctor.
Good talking to you.
Sure. So, starting Monday, anyone over 16 in the U.S. is now eligible for vaccination. It's far ahead of schedule and a stunning turnaround from just 4 months ago. How has the country achieved this?
Well, I think it's been through leadership and through collaboration between government, federal, state, local governments, and industry in trying to get vaccines to people. And the U.S. right now is vaccinating an average of about 3 million people a day. We've covered now we've given more than 208 million shots. And that means that about 33% of the U.S. population has now received a vaccine, which is really amazing.
But Doctor, for every nation's gain, it feels like it's someone else's loss. I mean, the speed of the rollout here means low-income nations who can't afford to pay the prices that the U.S. can for these doses have gone to the back of the line. What are your thoughts on this imbalance?
Well, I'm very concerned about the imbalance. We need to make sure that there's vaccines available for everybody around the world. I would say, though, that if you look at the epidemic, the U.S. has had more deaths than any other country. So it does make sense that the U.S. also right now is trying to vaccinate as quickly as it can because it really needs to cut down on the deaths. I mean, the U.S. has had over 500,000 people die. The 3 million people have died globally. More than 500,000 of those have been here in the U.S. So it makes sense for the U.S. to try to vaccinate ahead of everybody. But we then cannot stop. We need to start vaccinating everybody. And getting vaccines globally has to be a priority for the Biden administration.
Right. And also, there is that also point, right? I mean, as long as these countries do not have vaccinations, you can't really reach global herd immunity yet, can you?
Oh, absolutely. I mean, a pandemic means that the disease is everywhere. And as long as there's disease happening somewhere, it affects all of us. I mean, when I hear about what's happening right now in India, I clearly get concerned. Brazil, many other countries that are having major epidemics, there needs to be a global effort to try to stop the pandemics at those sites.
And with India, there's also that extra layer because it is the vaccine factory of the world, isn't it? I mean, it churns out something like 60% of all supplies.
Absolutely. The Serum Institute of India and many other manufacturers in India are the big producers of vaccines globally. And it makes sense that right now India does not want to release those vaccines for others. It wants to use them within its country. They have billions of people to vaccinate in that country.
So, Doctor, the Johnson & Johnson vaccine here in the U.S. is on pause over safety concerns. We hear results of whether it would resume or not is expected on Friday. How do you feel about what's going on?
Well, I think for once, I think that the pause was appropriate. It allows time to think what's going on and to understand and to make rational decisions. The Johnson & Johnson vaccine, I think it's a very good vaccine, just like the AstraZeneca vaccine. They do have this very rare side effects, but the side effect appears to be concentrated maybe in certain populations, mostly women, mostly under the age of 50. So my speculation is that the CDC and the advisory committee is going to make a recommendation very similar to the one of the European Medicine Agency, which is, use this vaccine for people over the age of 50 or over the age of 60. And if that's the case, and maybe only in men, and if that's the case, it still has a role to play, but it's not going to be a vaccine that is going to be available or ideal for necessarily everybody in the U.S. It may be very different globally, though.
Right. And of course, some people are saying, look, the pause may have dented confidence, but could it actually boosted confidence since there's actually been more time now to look into the vaccine?
I would hope that the pause gives people confidence because it gives people confidence in the system. It lets people know that the system is watching and making sure that things ran in an efficient and an effective way and protecting the health of people. So in my way of thinking, if this is giving out with transparency and with truth, it will actually boost up confidence.